Hello everyone, my name is Ana Varga and my presentation is on Giardia. So Giardia is a parasite known as Giardiasis, which is a disease it causes. Other commonly known names are Giardia duodenalis, Giardia lamblia, and Giardia intestinalis. Giardiasis is a diarrheal disease caused by the microscopic parasite Giardia. It is found in places such as soil, food, surfaces, or water. When a host is infected, the parasite lives in the intestine and is passed through feces. Once outside the body, Giardia can survive for weeks or months because it has a protective outer shell that not only allows it to survive for a long time, but also makes it tolerant to chlorine disinfectants. In fact, an infected person may shed between 1 to 10 billion cysts daily in their feces. Giardia can be found everywhere in the United States and in other countries. Worldwide, this disease infects 2% of adults and between 6 to 8% of children. So Giardia causes short-term intestinal symptoms that may last between 1 to 2 weeks or sometimes even longer. Symptoms normally begin 1 to 3 weeks after being infected. In fact, in order to diagnose Giardiasis, a healthcare provider will ask for you to submit poop samples. Those who are infected may experience symptoms such as diarrhea, gas, abdominal cramps, nausea or vomiting, dehydration, which pregnant women and infants are more likely to experience, itchy skin, hives, swelling of joints and eyes, and these symptoms may eventually lead to weight loss. There have also been cases where people with Giardia are asymptomatic, meaning they show no symptoms. As for children who get infected by Giardiasis, it can cause a delay in both physical and mental health. So Giardiasis is treatable and can be treated with drug medications such as those listed below. One of the most common form of medication is the metronidazole, which is an oral tablet. In fact, most of the medications patients are prescribed are oral treatments. The most common way Giardia is transmitted is through water, such as drinking contaminated water where Giardia may live, for example lakes, rivers, streams, ponds, and even springs. Other forms of transmission include eating uncooked food that contains Giardia organisms, touching contaminated surfaces such as bathroom handles, diaper pails. It can also be transmitted from person to person via hand to mouth or when coming into contact with infected feces and or visiting or traveling to countries where Giardia is common, such as Eastern Europe and Canada. As for its reservoirs, aside from humans, other reservoirs include cats, dogs, and even livestock. Although the likelihood of a human acquiring it from a dog or a cat is actually very small, the Giardia that infects humans is not the same type of Giardia that infects cats and dogs. Risk factors. So anyone can become infected with Giardia. Those who are most at risk include travelers, hikers, campers, and children in childcare settings. Travelers, especially international travelers, are at risk, especially if they are visiting countries where Giardia is common, such as Eastern Europe and Canada. Same thing goes for hikers. As for the campers, they are also at risk if they drink untreated water from lakes or rivers. Children in childcare settings are also at risk, especially if they are diaper-aged children. Giardiasis' bacterial life cycle consists of 4 main stages. During the first stage, cysts are absorbed into the human body through contaminated water or food. Once it's inside the body, the cyst makes its way into the small intestine, where each cyst replicates and produces 2 trophocytes. Once it's in the intestine, the trophocytes multiplies through binary fusion, where they remain free and then attached to the mucous membrane. From there, the parasites move towards the colon and are released from the body through feces. Prevention and control. Ways to prevent and control giardiasis is by practicing good hygiene, such as washing your hands frequently with soap and water for 20 seconds. Avoid drinking contaminated water, especially when swimming in lakes or rivers, or even when visiting recreational water venues. To prevent drinking contaminated water, the CDC suggests to drink from bottled water instead, or to use filters or even heat the water up to a boil for 1 minute. Another way to prevent giardiasis is by avoiding to eat contaminated food. That is by making sure to wash your vegetables thoroughly and avoid eating raw or uncooked food in countries that have poor food and water treatment. Lastly, prevent having contact with contaminated feces, and if you have pets, when cleaning up animal feces, make sure to wear disposable gloves and wash your hands right after. So my graphs were actually collected from a study that examined Giardiasis, epithelial resistance, and apoptosis. This first graph, figure 2, represents results taken from a spectroscopy that examined the epithelial resistance in Giardia. The bar graph compares control data to both Giardiasis raw data and corrected data. The x-axis, or should I say the y-axis, is the RE value, which stands for the epithelial resistance. Initially, what had happened was that the group collected raw data, but then had to go back in and make some corrections because they found that the surface area overestimated the epithelial barrier function, meaning it caused an increase in RE value, which was incorrect. So instead, they had to go back in and redo the data, which is the corrected data demonstrated by the far right bar graph. Figure 3 is epithelial apoptosis. Picture A, which is the top left-hand corner picture, demonstrates the control group, and picture B, the top right-hand corner picture, represents the patients with giardiasis. The arrows in both pictures demonstrate the epithelial apoptosis caused by condensed chromatin fragments. C is a graph that represents the apoptotic ratios of both controls and patients with giardiasis. Overall, the control had a 0.1% apoptotic ratio out of the total enterocyte count. As for the patients with giardiasis, their epithelial apoptosis ratio increased to a 0.2%. The lines demonstrated in this graph represents the means of both data. Thank you for listening to my presentation. I hope you guys enjoyed.